Hello there, my name is Dr. Carlo Oger. I'm a board certified emergency physician. Yesterday, I was snowboarding with my son, and of course, I was trying to pull some tricks. I tried to do a board grab where I jump and then grab the board. And instead of grabbing the board actually hit me and jammed my finger like so. And as you can see in the thumbnail, or you'll see right now, is that middle finger, and please excuse the graphic nature of it. You can see that this one here is swollen, a little bit discolored. And on the palmar side, you can see somewhat discoloration right here. So it posed me the question, I should make a video about when you have a jammed finger, is it broken? Is it not broken? And does it matter? And the long story short, if you want to cut the video short, is it doesn't matter much. Not for an adult. Kids are different. But if you are an adult or your bones have growth plates are fully fused, you can use this video as a guideline of what to do or not to do if you jam your finger. So I'm going to show you a video that I took of my hand. So this is the fingers, the middle finger of the right hand. You can see there's definitely swollen, and you look from the palmar side, there's definitely swelling and discoloration. When you bend the finger, it still bends. There's definitely swollen. First thing you're going to touch over each joint and identify where the pain is the worst. For me, it's on that joint right there. You're going to test each joint to make sure it's not loose and there's no deviation. You're going to compare the finger to the other one to determine how much injury there is and things like that. You're going to check your capillary refill, your sensation, and your range of motion. Do a physical exam. You're going to examine the finger and you're going to test the range of motion. Of course, it's going to be limited because there is pain and it hurts to do that. But there should be a fairly good range of motion. You shouldn't feel any cracking or popping when you do that. The other thing you're going to do is you're going to test the stability of the lateral stabilizer ligaments. So you're going to take each joint and kind of do maneuvers like that. And if it gives out, that's a tendon injury. That's something significant and probably needs to be seen by a hand specialist. You're going to push your finger like so and so. Make sure it doesn't give away or laxity. And then you're going to touch each joint like this, the MCP, metacarpophalangeal joint. That doesn't hurt. The PIP, the proximal interphalangeal joint, that one hurts. The distal phalangeal joint doesn't hurt at all. But if I do this to the finger, if I grab pressure on it, I can feel pain right here in the middle joint. So it definitely doesn't seem like it's a ligamentous injury. The ligaments are nice and tight. I don't feel any laxity giving out. There is definitely some swelling compared to the other finger, and there's some bruising right there at the joint. The other thing you want to check is sensation. I can feel my tip okay. I can do a capillary refill check where I press the finger and let it go. If the capillaries refill with blood within 2 seconds, then there's no vascular compromise and the finger's getting tons of blood flow and it's not a big deal. Obviously, there's going to be pain, but pain itself does not predict how bad the injury is because people deal with pain differently. I had pain when I sustained the injury, but my hands were cold, so I didn't really feel it that much until later when I warmed up and then try to do things with my hand, and I can't really do it as well. So, is it broke or not? It really doesn't matter. My finger is functional. It's doing everything it needs to do, even if there's a crack. Now, every crack, fracture is really the same thing medically. A fracture, a break, it's all the same thing. It's broke or isn't broke. But for practical purposes, I compare a crack to a linear, like a crack on a windshield or a crack on your cell phone where the cell phone is still functional. There's just a little line through it, but you can still use it. It works fine. A break has the connotation that there's something out of place. It's a significant separation, significant injury. So that's the difference between a crack and a break or a fracture. But in medical terms, it's all the same thing. Now for fingers, toes included, there's not much you're going to do if the finger has stability, it's got good function. All you need is a finger splint. You can buy those over the counter at Walmart, at Amazon. All you want to do is something to immobilize that finger so it can heal in place. So it's not re-injuring itself, so it has time to rest and heal over time. Icing it for the first 48 to 72 hours to keep the swelling down. And of course, ibuprofen, Tylenol, or both for pain control. The only danger is, so of course, if the finger has laxity to it, like you do that and it gives way, that's a ligamentous injury. That's not something you need to see a doctor right away. You do not need to go to emergency department for an isolated finger injury unless there's gross deformity. If the finger is pointing outwards or something, You have to rule out dislocations. Dislocations need to be reduced as soon as possible. And some fracture dislocations, fracture with angulation, they need to be realigned and then splinted in place. So you need to leave that to the professionals, and that would be a reason to go to the urgent care versus the emergency department, because obviously we can numb the finger by injecting lidocaine and numbing the finger, do a finger block, and then realigning the fracture side, stabilizing it with a splint. Usually we splint it next to the finger on the side of it so that the two together can help immobilize that finger joint until it starts healing. Maybe not a cast over time, but those are pretty rare for finger injuries. Most finger injuries is just immobilization with an aluminum foam splint and rest elevation, Tylenol Motrin, and stuff like that. So the long story short is I do think I cracked my finger. It feels like a crack. I've had fractures in my finger before, and it feels just like that. But I'm still functional. I can still grab my phone. I can still type on the computer. So it's very minimal. Could it be just a jammed finger? It's just a ligamentous injury and sore? Sure. The bottom line is it won't make a difference. So this is not something I'm even going to do an x-ray about. I'm just going to let it heal over time and then assume normal function. So if you had a jammed finger and there's no gross deformity, there's no instability, there's good sensation, good capillary refill, and you can maybe limit it, but you can close that hand, no need to be seen by a doctor. Just treat it with things I just said. If there is instability, if the blood flow doesn't seem right, there are multiple digits involved. If there's a deformity of the fingers pointing out the other way, then yes, you should see somebody fairly soon, but not necessarily emergency unless it actually is pointing the wrong way. So that is it for this video. I hope you learned something about it, whether my finger is jammed, cracked, or broken, and what to do about it or not to do. Should I go to the ER or not? And all those things we answer in this video. So hopefully you enjoy this a lot. You learned some, and we'll see you on our next video. Bye-bye.